I always thought it was important for leaders to really think about what they stand for. And in fact, when I would interview potential leaders to our organization, I would ask them that question. What do you stand for as a leader? I think the quickest takeaway, which has been sort of my mantra my whole career, is focus on people. I think today we have to pay attention to the needs of the people in the organization. I think in most organizations, workforce development is not held up as high as it should be. Almost every organization depends on people for success. In healthcare, it's absolutely at the center of what we do. We do nothing without our people, and they deliver the care that our patients are expecting. So we constantly thought about how do we engage our workforce and how do we develop their talents. It was true at the front line in terms of educational initiatives, tuition assistance so they could really move forward in their careers. But it was also about leadership, because if you don't have great leaders in place, they don't even understand how to develop the workforce. We actually had 3 leadership academies at Henry Ford. One was for new leaders, one was mid-career, and then one was advanced leadership, to give people experiential kind of learning with real projects to really demonstrate what their capabilities were. And we made sure that all of those leadership academies were very diverse in terms of the pool of individuals who participated. And that helped us really improve our pipeline of diverse candidates into leadership roles in the organization. Diversity was so intrinsic in everything we did. It was part of our DNA, and particularly at Henry Ford, because we were in a community that was 80% African American. So diversity really defined us, and we also had people in Detroit that spoke, I think, 60 languages. So we built it into every part of our strategic plan. So it was clearly part of our people strategy in terms of attracting diverse talent. We also looked at it in terms of our academic mission. We were training literally hundreds of physicians and nurses and pharmacists and people at all levels of the organization. And so it was really important that they had cultural competence in their care. And it was built into the curriculum and the learning that they had every day. The experience I had in Detroit during the 2000s, particularly during the Great Recession, was pretty extraordinary. I was in a community that had lost 2 companies to bankruptcy, but they did fortunately come back, GM and Chrysler. Our city went bankrupt. We lost 30% of our population in 10 years. Michigan was the only state in the country that did not grow in population during that decade. We saw so many jobs lost, 700,000 in the state. So it was a very difficult time, and in fact, we were in the midst of building a brand new hospital at that time. And people said, well, are you gonna not finish it? I said, are you kidding me? We're betting the farm on this. So I think during tough times, you have to take more risk. And you have to believe in yourself and your team and your organization. And that has to come across in a way that creates hopefulness so that people don't give up, that they are resilient and they stay with you during tough times. I think I'd put the investment in the workforce as number 1, because without the workforce, there is no healthcare. And it's so important to look at all the resources that are going into recruiting, retaining, really look at the total cost of what's going on and perhaps reallocating some of those resources to something new and different. And that means much more of a focus on workforce development, allowing people perhaps to get away from the bedside for a period of time, but remain in the organization in a different role. And then perhaps they will go back to the bedside at a time when they feel that they're recharged and re-energized to do the work. But it's really important now that workforce is the number 1 priority, or else I think organizations are going to close. I think you can look anywhere in healthcare right now and you'll see gaps and you'll see opportunity. And I think people have to be very positive about the opportunities that this creates. because there's still a lot of people in communities that don't have great jobs. Let's go into the community and find those people and look at what it's going to take for them to have the capabilities to move into some of these roles. Well, I used to say when it came to educational journeys that one of the greatest things I ever heard about as a CEO was people saying, "This is the best place I've ever worked." And in fact, often when I would ask someone, "Why is it the best place you've ever worked?" they would tell me a story about how they started as a housekeeper and now we're an RN. And we had so many of those stories at Henry Ford because we always encouraged education, we provided tuition assistance, and we also had our own educational programs that really opened the door for a lot of people. I think the model at InStride to pay upfront for education is absolutely critical, especially if you believe in a diverse workforce, because often people don't have the resources to start their education. And so many people don't, even if you have tuition reimbursement in place. And in one of the organizations I worked with in the past, we actually made that move. We shifted it to paying up front. And it opened the door for many, many more people to have an educational opportunity. So, it's sort of a one-time cost, if you think about it. Many times when people go through tough times, they stop their educational support, they stop their leadership development programs, they stop all this stuff. We did not. We made very hard decisions in terms of staffing, but we did not in any way diminish those aspects of what we did because we wanted to send the right messages, that this is important. And so I think being very clear about what's important, that we will get through this, and we have the talent here to do it. I think that's absolutely critical. And InStride for me creates the avenue for many organizations to try something new and do it differently and take the resources they might have been spending and spending them better. So it's very exciting. I am so proud to be an advisor for InStride because InStride is the kind of organization I kind of wish had been there when I was leading in my career. It totally reflects my values. It totally reflects what I believe in terms of caring for people. In healthcare, I used to say my job was to care for the people that care for people. And, one way that you do that is through education and workforce development and creating new tools that allow you to do that exceptionally well. So it's very exciting to be a part of the InStride organization and to help promote, frankly, what I believe everyone should be doing.